join us in the Pledge of Allegiance and a moment of silence. I pledge
Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you very much. Okay, so let the record show that we do have a quorum with all members present. First order of business is the adoption of the agenda. Are there any changes to the agenda as presented? Okay, anything from the board? Very well, I'll entertain a motion to adopt the agenda as presented.
Mr. Chairman, I move to adopt the agenda as presented.
Very well, we have a motion and a second. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, nay. All right, motion carries. Next item is public comment. Is there any general public comment?
Good evening, members of the board. My name will be Kim Smith. I want to thank the board tonight for what you have recently done. You took the oath of office to uphold the Constitution of the United States. In so doing, you wandered into the territory of the doctrine of lesser magistrates. When you adopted the Second Amendment resolution, you interposed yourselves between the possibility of a government that would deny us the capability to preserve our life. That doctrine stems 200 years after the Magna Carta, more than. And although I wasn't there, John Knox apparently articulated quite well. It says that when you take the same oath of office, you honor it when your constituents are at risk. And you will probably see other resolutions coming your way. I'd like you to bear in mind the meaning of magistrates under the oath of office to the Constitution and what the implications might be of adverse action from higher magistrates on your constituency. But thank you and have a successful meeting.
Thank you. All right, any other public comment? What you got back there, Federico? Anybody? All right. Very well, we will close public comment then. The next item on the agenda is the consent agenda, which is the approval of the January 28th and February 4th minutes. Any changes to the minutes? Anybody notice? If not, I would entertain a motion to approve the consent agenda.
Mr. Chairman, I move that we approve the minutes from 1/28/2026 and 2/04/2026.
Very well, we have a motion
Second.
and second to approve the consent agenda as presented. Any further discussion on this? All in favor say aye.
Aye.
Opposed, nay. Okay, the chairman votes aye on that. All right, so next up, special appearances. We have the opioid grant cooperative agreement. We have Dave Nagel and Susan Morrow. Both of you all are going to present. All right. I assume you're not Susan Morrow.
Not today. Good evening, and thank you for entertaining us this evening. I'm Dave Noggle. I'm the Recovery Court Coordinator for Orange, Madison County.
Turn the mic on.
I'm sorry. I'm the recovery court coordinator for the Orange Madison Recovery Court. I've been in that capacity for a little over 2 years. With me tonight is Susan Morrow, who's the Assistant Director at OAR, Jefferson Area Community Corrections. Also Dr. Mahan, Laura Mahan, who is the Orange County Opioid Response Coordinator, and Ashley Jacobs from Orange County as well, Director of HR now. They will be available to answer any questions you may have that I don't answer through the PowerPoint this evening. I'm here tonight to share with you a little bit about the Orange County Madison Recovery Court, our successes, and the impact that it has had on Madison and Orange counties. I also want to encourage you to partner again with OAR and Orange County as our BJA grant comes to the end of its 5-year cycle. We're seeking to apply for an Opioid Abatement Authority regional grant that will help sustain the recovery court as well as expand the services beyond what we currently offer. So the Recovery Court Act, Virginia General Assembly recognizes there's a critical need in Virginia for effective treatment programs. Reduce the incidence of substance use disorders, family separation, due to parental substance use disorders, substance-related crimes. As you see, our mission statement is to serve both Madison and Orange County. We address the root causes of substance abuse disorder that drives criminal behavior. We provide substance use treatment, court-supervised intervention, and to promote this mission, we create long-lasting solutions, a stronger community, and increase public safety. Little history about the Recovery Court. It started in 2019. They started discussing it. Later in 2019, the planning team submitted an application for technical support through the Adult Drug Court Planning Initiative. Planning team was approved for training. They met during Zoom. This was during COVID. This was before I was part of it. I understand it was quite a labor of love to get it off the ground during COVID. In 2021, we were approved for the federal grant award, and we received matching grants from Orange and Madison County. We onboarded our first participant on May 25th of 2022. Recovery courts are specialized court dockets. They exist outside, although they operate in the circuit court, they operate outside of the circuit court. It's a weekly process, so there's ongoing judicial monitoring. It's intensive treatment. It's more intensive than intensive supervised probation with state probation. Strict supervision of individuals. There's moderate to severe substance use disorders. People that are in the program are high risk of reoffending. They're high risk and high need individuals. They're drug-driven felony cases, and their participation is voluntary. They can terminate their participation at any time. The goals of Recovery Court include reducing substance use disorders among defendants, reducing recidivism, reducing substance-related court workloads, increasing personal and familial societal accountability among defendants, and promoting effective planning and use of resources among the criminal justice system and community agencies. Recovery courts have proven to be highly effective for treating individuals suffering from substance use disorders. Recovery court keeps individuals in treatment long enough for it to work while supervising them closely. They are provided with intensive treatment and other services they require to stay clean, remain clean, and sober. They're held accountable by the recovery court judge for meeting their obligations to the court, society, themselves, and their family. Frequently and randomly tested for substance use, required to appear in court frequently so that the judge may review the progress and celebrate the successes as well as hold them accountable for any failure to meet proximal goals. And they're rewarded for doing well or sanctioned when they did not live up to those obligations. Best practices and advisory boards, so we're not doing this all alone. We're following national best practices. All Rise provides technical assistance. They partner with the Bureau of Justice Administration. They establish those best practices based on statistics. We also have an advisory board that oversees the Orange Madison Recovery Court. That's made up of a cross-section of stakeholders within our organization. To date, we have had 43 participants. Currently, there are 4 participants in Madison, 16 in Orange. Madison has had 5 graduates, including that first person we onboarded in 2021. Orange has had 11 graduates. We've had 1 termination, which was actually shared jointly between Orange and Madison County. He's the only participant that's been participated as a dual county participant. And Orange County has had 6 terminations. Our successes. So in November, representatives from All Rise came and met with our team. The Observed Recovery Court provided a training, interviewed everyone, and after all the dust settled and we got the reports back, there were 4 items we need to address. Typically, a program of our age would have a significant higher number. We have 4. We've already addressed 1 of them, and 1 of them is our long-term goal. And it's just aligning us more with the best practices that All Rise is looking for. And this is an email. I'm not going to read it to you. I'll let you read it. But I think that says a lot about the successes that we've had to date. Rough savings. So we can slice numbers any number of ways. The simplest way is what I tried to represent here. So the assumption is, if you're in recovery court, you're not in jail. Because they are high risk, they are long-term consumers of the correctional product. Most of them are on maybe their 3rd violation. They are looking at significant time. We've had 42 participants since the program started. The total days spent in the program of those participants is 18,124 days. Total days the participants spent in CVRJ while in the program, 197 days. Subtotal, 17,927 days at a cost of $113.70 per day is a rough total savings of $2,039,554.79. We face challenges. Being rural, we face the same challenges a lot of the other organizations do in Orange and Madison. Transportation. Medicaid transportation is unreliable. Uber and Lyft is non-existent. There's a need for family counseling and family reunification. There are a limited number of community support groups, such as peer-led support groups, Alcoholics Anonymous, and Narcotics Anonymous. There is a lack of behavioral health and medication-assisted treatment in both counties. A lack of sober living options and financial barriers to sober living environments. There's a need for ongoing post-program support for our alumni, and that goes back to the limited number of support groups. We're focusing on recovery capital for our participants. So recovery capital, we assess for the things that they need to support long-term lasting sobriety while in the program and after graduating from the program. self-esteem, self-efficacy, communication skills, coping skills, resilience, living life on life's terms. Developing a social network, positive friendship networks, and the commitment to those networks, becoming a better citizen of our community. Access to recovery treatment, access to recovery coaches, jobs, houses, and community supports. We assess them for recovery capital when they come into the program, at 6 months, at a year, and at graduation. What I have found is those that are terminated sometimes will rapidly lose recovery capital. They'll gain it and they'll lose it. Where we want to grow: family counseling and reunification, destigmatizing events, peer support groups, alumni support groups, transportation assistance, sober living support, reentry services, behavioral health, MAT treatment, and be making that more accessible in both counties. Our current funding, which will expire on June 30th, is the BJA grant. We're in the 5th year of that grant. Matching county funding. To date, Madison County has invested $63,420 into the Recovery Court program over the term of that 5-year period. We have also managed to leverage 2 years of SOAR funding to create intensive outpatient treatment in the OAR office in Orange that's available to the participants of both Madison and Orange Recovery Court. There is no intensive outpatient treatment in either county until we created it through the SOAR funding in 2025. So our timeline for the Opioid Abatement Authority grant, the regional grant, in the first 2 years, we will be piloting the family reunification and the additional services we want to provide that was on the previous slide. And then after that 2-year period, we plan on branching this out as part of that regional grant and bringing Fluvanna and Nelson County that also have recovery courts into the regional grant. Year 3, we'll expand services, hopefully Fluvanna first, while we continue services to Orange and Madison, and then eventually in year 4, expand into Nelson. Reevaluate in year 5, and continue services in all of those counties. I'm assuming that, even though I created that PowerPoint, it seems like it's come to an abrupt end. Do you have any questions?
Questions from the board?
May I add, Mr. Chairman, just a little bit to the context as well, especially for our 2 newer Board of Supervisors. So the Recovery Court, or some people know it as Drug Court, whichever way, we appreciate the programming. It's been around for a while. How we've been funding it, at least the last 2 fiscal years, maybe the last 3, but I know at least the last 2, is with your direct settlement funds that come through your settlement you did with the opioid class action lawsuit. What we would propose, if you like what you hear today, and because there's a grant deadline on, you just told me earlier, and I already forgot, March 16th. March 16th is the deadline. So we already got a great established relationship, but I would recommend, if you like what you hear, to move and authorize move forward, for us to designate, we'll work with OAA, which is the Opioid Abatement Authority, which was set up by the General Assembly when the lawsuit was settled. For those funds, we have not touched those funds yet, and I think it'd be a good use of it. I believe there was peer support programming in this as well.
Yeah.
So there's an extension beyond just the drug court. And we got great partners. I appreciate Ms. Jacobs being here tonight from Orange County. So just to give you a little background on how you've been funding the program.
So what constitutes peer support? Exactly.
Would you like to speak on that versus my?
What?
No, I can speak to it. I know that Dr. Mahan is experienced with peer recovery.
Peer peer support is paraprofessional service provided by individuals with lived experience. In the case of Recovery Court and our peer support program, we have certified peers who have lived experience in the criminal justice system and with substance use recovery. It's certified by the Department of Behavioral Health Services. They go through a 72-hour training and spend 500 hours before they can be certified and take an exam. And it's just remarkably helpful particularly for our participants. They're able to relate really easily to these individuals who are supportive of the program and supportive of their recovery.
So it's like case management? It's a form of case management?
It is sort of a form of case management. It's more of a partnership than case management is. We do employ case managers for the Recovery Court, or a case manager, and Dave also provides case management.
So, and how long would this peer support last? I mean, at some point, somebody's convinced that the individual is out of the woods, so to speak, and ready to carry on
Actually, I think
sober life?
it can go on indefinitely.
Oh,
So
yeah?
that is one of our post-program support options. So they're with peer support the whole time they're in the program.
Questions, yeah.
Yeah, just a quick question on the, over $2 million in savings from the criminal justice system. So Central Virginia Regional Jail says it's $113 a day. That's what it costs to put somebody,
Yes, that number came from a criminal justice planner, $113.77 a day.
okay? No, that's a great savings for sure. Thank you.
And so roughly how many days have they spent in this? I see 18,124 days, but
So if it's done perfectly, no positive urine screens, no missed appointments, no missed attendance in court, 14 months is generally how long the program lasts. We've had several people that have done it in roughly 14 months. We have some that have taken a couple years to get through it because they get set back. And there are 5 phases to graduate. The first phase is 60 days. All the other phases are 90 days. And some people spend very long times struggling to get out of the first phase. But they can make it through.
so the difference between termination and graduation is what?
So graduation, of course, is a celebration. And
Incarceration.
so their graduation, the final entry of whatever plea agreement that they agree to bring them into the program, that gets resolved. Most of the time, that agreement is the charges are either dismissed or, having been convicted, they are sentenced to whatever agreed sentence was in the plea agreement, which is usually no time. Failure to graduate results in a return to the circuit court, again in front of the presiding judge, which is Judge Francine. At that point, they are found in violation of that plea agreement, and then they are continued to be sentenced to whatever sentence they had agreed to.
Is that termination?
Hence
That is
termination,
Got a question, Mr.
yeah. Yes, certainly.
The question I have, I guess, deals with recidivism. Is your program, the folks in your program compared to peers that do not participate in your program, is there any stats on the success versus or return or failure of that individual?
So, nothing long-term for Orange and Madison. So we celebrated our first graduate in January of 2024. We've had a total of 16 graduates. I tracked them, running their records. Every 6 months, we have had no new arrests of anyone that has graduated from the program.
So it looks, so All Rise, that program started well before the opioid settlements began, is that right?
Yes. I don't know
Yeah.
when.
But I mean, it's an established program, that's what I was getting.
1989, I'm told.
Yeah, okay. So what is SOR funding? What is that acronym?
So I have to get my cheat sheet. Write all the
Oh, good.
acronyms down. It's the state opioid response,
State,
opioid response.
okay,
So
all right.
SAMHSA administers SOAR.
So, so what will, you all are applying for another grant. What's the name of the grant you're applying for? The BJA is expiring.
It's
so
the
what's
Opioid Abatement Authority Regional
OAA grant, okay. So what would Madison's financial responsibility likely be in that?
I will turn that over to the numbers lady.
And you have, Chairman, there we go. You'll have a handout in front of you that I think will go along with Ms. Murray's explanation to your question.
Okay.
That's a fairly rough estimate for the entire cost of the project over the 5 years. There will be a request for matching funds from Madison County each year. According to the grant makers, the Opioid Abatement Authority, the higher our matching funds are, the more likely we are to get a grant award. Same with the more localities that we have involved, the more likely we will be to get an award, which is why it's great that we can expand into Nelson and Fluvanna. So I refrained from suggesting what amount Madison might want to contribute as matching funds. Obviously, it has to be affordable for Madison, and obviously I want it to be as much as it can be, so that we'll have a better chance of getting funded.
But this is a target here that we've got, perhaps?
That's my estimate of the actual total cost of the project. And
What
that
would-
would be mostly the opioid abatement funds. We also intend to apply for some Supreme Court funding, which if we receive that, that's a more permanent solution. If we do receive Supreme Court funding, that would just take away from the award, the opioid abatement award. Like, I'm estimating we would get $75,000 from the Supreme Court, and that would just reduce our opioid abatement award by $75,000 for that year.
Okay,
And same with anything that Madison would contribute, it would just reduce the amount of the award.
but you have a good idea of what it's gonna take to submit a winning, or not a winning, but a favorable grant
Yes,
submission.
I think we do. I've got help.
Yeah.
Dr. Mahan is here to help with that. And there are, I don't know what they call them, but there's regional representatives from OAA who will come and work with us, and hopefully we'll be able to submit something that's supported by the OAA.
It's Mike again. I see what it is. Give the county administrator faulty Mike. Means I talk too much. So I believe, in fairness, if I may, because I think this came up at our agenda review meeting, Ms. Dupree, who's our regional rep for OAA, I believe she has at least looked at the concept of this and feels that it meets, because you're either, forget the words now, you're remediating or mitigating, is what those funds are for. So she has looked at this, and while that's not stamping it yes today, it's just saying the criteria, it looks like it would meet standards.
Okay. So, Judd, I mean, you being on the jail board, so it appears, first arithmetic is probably saving us money for days in jail, right?
Yeah, that 100, I think would be anyway, but I think the cost, from what I understood, and I could be wrong, but it was between $50 and $60 a day. So you could be adding in healthcare, someone's sick, those type of things, so that might raise that up to 112 or whatever it was. Yeah, I think it definitely saves the county money.
Okay.
Now, I should have brought the presentation up. One thing to point out that's different, and I may have included you in an email, I've been working with Superintendent Dyer at CVRJ, the medication-assisted treatment process, which they have identified as a lack of that for their program, but they're doing that outside of the jail, but there's still that need in the jail. So we're working with him to see if, opioid funds can be used for that as well. It's a pretty expensive program. I think they're using Suboxone, some other things, but it was very eye-opening of the expense to administer that for 12 or 16 people was in the, I think, 30+ thousand range. So I think he's going to let the jail board talk about that. But that MAT is separate than what OAR does, but there's still a need, whether you're incarcerated or not, to help with that medication-assisted treatment. So just want to point that out as well.
Mr. Weekly, quick question, and you may not know this off the top of your head. How much money is available from the opiate settlement for us to pay towards this?
Very good question. I'm drafting an email to Mr. Dupree right now just to check that, because figures may have gone awry since I last remembered. But we'll check on that and I'll report back. If I find it here tonight before the meeting's over with, I'll respond to you. I believe there's enough there to cover this. I believe it was north of $700,000. The way that worked, it sounded great when we had the settlement. It is great, but they gave the counties about 30 to 35% direct settlement. We're going to hold 65% at OAA, and you have to apply for it. So that's kind of how it worked. But I'll get that total, sir.
Okay, thank you.
You're welcome.
You got something, Mike?
Yeah. So your timeline is saying, and maybe I missed this during the speaking, year 3, you're going to get Fluvanna in this. And I see over here on this chart here, on fiscal year 27, you've got Fluvanna. Are they already participating in this?
No.
So what year in your timeline, or where year are we in this?
Oh, we haven't started yet. Year
Oh.
1 would begin July
This is
1.
the new grant that they're talking about. Right?
Correct,
This is the timeline for the new OAA grant.
correct. And
Gotcha.
that
Okay.
would begin, so, and it's interesting, Fluvanna and Nelson are in a similar position to Orange. Fluvanna lost their federal grant in September of last year. And they do have some Supreme Court funding, but they need to hire, there's additional positions and additional needs. There are now gaps in their program. OAR is basically supporting them through this dry period. So we are looking to fund some of those things for Fluvanna right away. And also for all of the courts, the housing support, like supporting housing and transportation, that can easily be implemented. It just needs the funding. And so all of the courts will benefit from that right away as well. Then Nelson will be concluding their federal grant next September, and will also be in need of resupplying those funds so they can continue their program. So this grant is hopefully going to get all of that in one big bite.
So, go ahead.
Just a quick question. Is there an increase or decrease in the amount of drug-related offenses now? I seem to have read in the news that it's declining, but is that something you're seeing or not?
We need to get the criminal justice planner up here for that one, I think.
Oh, just, yeah.
I don't know that I can fully speak to that. Knowing what little I know, they're declining certainly from, say, 2018, 2019. They're down. Whether they're down this year compared to last year, I can't really say.
And I think the other thing, Mr. Buchanan, is a lot of their participants are going to be folks that are not necessarily new drug charges versus folks that are facing probation violations because they're just having difficulty getting it together.
Right, and they're not all fully drug charges. There's a lot of theft that goes on because people are trying to obtain drugs. There's a lot of fraud that goes on. when trying to obtain drugs, so we do take those cases as well.
My question would be, does each one of these counties stand alone, or are all these funds put together for in one big pot and divided up between 4 counties?
All the funds are put together in one big pot. Orange has agreed to be the fiscal administrator on the grant. But it is obviously going to be very important that we use the funds in the way that we set it out here, or at least in the way that the budget is set up when we turn the proposal in. And I could certainly get for each of you, like, the amount that is coming to your county.
All right. Any further questions? All right. Thank you.
Thank you.
Appreciate it.
So, being that their grant deadline's coming up about mid-March,
Yeah.
you would have some opportunity to bring this back at your March 10th meeting. I realize that may put you close, but there are some assumptions you can make in draft form to do that. So my recommendation would be you could take action here tonight, but quite frankly, I need to get that information back that Mr. Jewett raised. So certainly we can bring it back as old business as March 10th with the understanding. The only question I'm hearing here tonight was funds available. So we can provide that. We can provide you with both. We'll give you the direct settlement funds that are available. Again, a different way we receive funding, and as well as what's in the OAA, what I would call fund balance, or Virginia OAA. There's probably other OAAs in other states. So we can bring that back, Mr. Chairman, if the board desires, at March 10th. Are there other questions or information that the board would have about this so I can bring back information as a whole? Right now, I'm just tracking the balance of funds.
Right. Yeah, so we've been participating. I mean, I personally, what does the board feel like we should have a county administrator, have Jonathan proceed with the participation in this as long as the finances work out, right? And
That's one way to do it.
Yeah.
I don't want you to feel rushed. I mean, we can definitely bring this back as old business March 10th. And I don't think it needs a formal resolution. We generally would ask for the cooperative agreement, kind of to put in the packet what that would look like, but we can bring back those items. You certainly can approve it tonight if you want, pending funding availability. It's your purview. I just want to make sure I answer any questions you have so you feel comfortable before proceeding.
so when is the grant due again? March the 16th. So our March 10th is that, you'll have a space you can fill us in, or is that's way too late, or what? What do you think?
I mean, I'll do whatever is needed, and I would go ahead and we would write and prepare the grant as if Madison County was gonna be a go.
All right, so what's the pleasure of the board? Any opinions?
I'm sorry, I think I missed that.
I'm sorry, no, I was just asking. the other
Is there any
board
way we
members.
can get the information quicker? But we still have to make a decision at a
Yeah,
meeting?
and- Right, we would have to either call a special meeting, I guess we could,
You have a joint meeting too on next Wednesday, I think.
Yeah.
You could take it up then, which
On
is
the
March
5th.
4th, I believe.
second, third, fourth, yeah.
So we
Fourth.
certainly would have information by then.
Okay.
May I ask a question, Mr. Weekly? Do you have a login to the portal?
I'm, got that up right now.
Do-
I'm working on that.
Okay, okay,
Yeah.
because I could help pull that if necessary.
All right, then how about we do that?
It,
Well, that
it
time
might,
we'll
it's
have
a
that
bit tricky,
information.
so I'm not sure if.
They need a commitment sooner rather than later.
Right.
I mean, we're either gonna commit to it or we aren't. And of course, the 800-pound gorilla in the room is the money situation.
Well, the commitment part's easy enough, right? It's just the amount of the money, right?
Yeah, but the money's required for the commitment.
Well, how
So
much though?
ultimately-
Is the
well,
amount
that's what
though,
we're
right?
asking.
Right.
You could, they can do a conditional if they so choose.
Decision on the 4th, yeah. All right. We will put that on the agenda for the 4th, I think, Jonathan.
Okay,
How's that?
that'll work.
Okay. Anything further? All right. Thank you all very much.
Thank you.
Okay, next order of business is the fiscal year 25 audit report. Mr. David Foley from Robinson Farmer Cox. He's going to read us the 175-page report.
Every word. Well, good evening, Mr. Chair, members of the board. I'm glad to be with you all here this evening. Again, my name is David Foley. I'm a partner with Robinson Farmer Cox Associates, and we performed the audit, the financial statement audit for the county's fiscal year ended June 30th, 2025. So here to present the results of that to you all. As part of the audit, we issue two different documents. One is the audited financial report, and the second is our communication letter with those charged with governance. But before I get into the results of the audit, just would like to give a brief overview of the audit that we do for the county. So for the financial statement audit, there's really three main pieces of the audit that we do. One, of course, is we audit the financial statements of the county, audit the numbers to make sure that the county's financial statements are prepared in accordance with generally accepted accounting principles. The other two pieces of the audit we do in accordance with government auditing standards. One of which is, in addition to just looking at the numbers themselves, when we're out doing the audit, we gain an understanding and review the internal controls that the county has in place over its financial reporting. We do this to design our test that we're going to perform over the financial statements. And then the third piece of the audit is the federal compliance piece. So whenever a locality expends over $750,000 in federal grant funds, you have to undergo, as part of your financial statement audit, you're required to undergo what's called the single audit, which is done in accordance with uniform guidance. So when we're out doing the audit for the major federal grant programs of the county and schools, OMB provides a compliance supplement with a list of various compliance requirements that the county and schools have to comply with when they're expending those federal grant funds. So as part of the audit, we go through that checklist to make sure that the county and schools are compliant with those requirements. So those are the three main pieces of the audit that we do. So as such, included in the audited financial report, there are three different reports from us that communicate the results of the audit. The first report is towards the front of the report. It's on numbered page 7, and this is our independent auditor's report. And in this report is where we state we did perform an audit on the county's financial statements. And in the second paragraph is where we issue our opinion on the county's financial statements. And we have issued a unmodified opinion on the county's financial statements, which is the cleanest opinion an auditor can give on a set of financial statements. Basically, an unmodified opinion means that the county's financial statements have been prepared in accordance with generally accepted accounting principles. So again, a clean opinion on the county's financial statements. The other two reports from us are in the back of the report in the compliance section. The first report back there is our report over the internal controls over financial reporting for the county. This is on page 165. So this report was clean as well. We noted no significant deficiencies or material weaknesses in the county or schools' internal control over financial reporting. Overall, we feel that the county has strong internal controls in place over its financial reporting. And then the third and final report from us is 2 pages over on page 167. This is our report over the county's compliance with its major federal grant programs. This report was clean as well. No significant deficiencies or material weaknesses were noted in the county's compliance with its federal grant programs. Also, no items of non-compliance were noted as part of the audit. So those are the 3 reports from us. Again, all 3 reports were clean, so a clean audit again for the county this year. Just would like to highlight, I know this is a big document, but just would like to highlight just a couple exhibits in the financial statements themselves. Back towards the front of the report, page 23 is Exhibit 3. This exhibit is the balance sheet for the county's governmental funds. This statement reports the assets, liabilities, deferred inflows, and fund balance for the county's governmental funds at the end of the fiscal year. And then there's various columns on this exhibit for the various governmental funds that the county has. The general fund being the main fund of the county, main operating fund of the county, and then the capital improvement fund. So again, this reports assets, liabilities, and fund balances. So at the end of the fiscal year, we can see the county's assets in its general fund were $34.6 million compared to liabilities and deferred inflows of a little over $9 million. So then down towards the bottom of the statement is the fund balances of the county's governmental funds. Again, fund balance is the excess of the county's assets over its liabilities and deferred inflows. So total fund balance at the end of the year for the general fund was $25.5 million, and then that fund balance is further broken down between the various categories: non-spendable, restricted, assigned, and unassigned. The other statement I always like to highlight and point out is the next page over, Exhibit 4. This is the statement of revenues, expenditures, and changes in fund balance. So this statement reports the revenues, expenditures, and changes in fund balance for the county's governmental funds. Again, we got the multiple columns for the different funds. But again, with the general fund, total revenues for the fiscal year were $36.7 million. Then total expenditures, a little about halfway down the page, of 36.1, which had, the general fund had an excess of revenues over expenditures of $633K, and then 2.8 was transferred out to the capital improvement fund for capital projects, and then down towards the bottom of that statement, you can see the change in fund balance during the year. So fund balance went down by $2.1 million during the fiscal year.
So David, how do you know, the transfer out of 2.8, how do we know that that was for capital?
Because
that's
if
in
you
the
go
next
over to
column.
the next column,
Next
you can see
column,
the
yeah, I see it.
transfer in
Yeah,
of
yeah.
that.
Okay.
So those are just a few of the exhibits I'd like to highlight. Next, would just like to briefly go over the communication letter with those charged with governance. So what this letter is, auditing standards require that we communicate certain things to you all at the end of an audit. And so we do so in the form of this communication letter. Just would like to briefly go through these with you all. So just a few communications here. Some related to the qualitative aspects of accounting practices. In this letter, we state that management is responsible for the selection and use of appropriate accounting policies. Accounting estimates are an integral part of the financial statements. Some examples of some of the more significant estimates that are used in the financial statements is one, management's estimate of depreciable lives related to capital assets, which that's used to determine depreciation expense. And then management's estimate of the pension and other post-employment liabilities. These estimates are actually derived by an independent actuary that does evaluation to determine those. So those are some of the more significant estimates that are included in the financial statements. Difficulties encountered in performing the audit. We had no difficulties in dealing with management during the audit. If we had any difficulties, we'd have to communicate those to you all. Really, all the county and school staff, they do an excellent job of working with us during the audit. They always have a bunch of documents ready for us when we come on site so that we're able to dive right into the audit, as well as while we're on site, they do an excellent job of answering any questions that we have, as well as pulling any additional information that we need for the audit. You know, we certainly understand that the county and school staff are busy doing their day-to-day jobs, and when you have 4 auditors walking in and out of your office for a week, I'm sure that can be a little cumbersome, but they always do an excellent job of working with us. So just would like to commend the staff for that. Corrected or uncorrected misstatements. There were no uncorrected misstatements. Any adjustments that we had were posted to the county's financial system, so that way the county's internal records agree with the audited financial statements. Just a few more here. Disagreements with management. We had no disagreements with management in terms of any financial accounting, reporting, or auditing matters. Again, we would have to report those to you all if we had any. Management representations. We do request certain representations from management at the end of the audit, which we get that in the form of a signed rep letter. And then lastly, management's consultations with other independent accountants. As far as we're aware, management did not consult with any other independent accountants in terms of second opinion shopping. But again, these are just the required communications that we have to make to you all at the end of the audit. But that's all I have, but be happy to answer any questions you all may have. Again, it was a clean audit for the county.
Thank you. Questions from the board? Mr. Weekly, you got something?
I think just in general, and thank you, David, for you and your team's work. One of the things I can appreciate, and I'm not a CPA or an accountant, is GASB, they throw various standards at you year over year, so that alone can cause some delays. Chairman Yao and I were talking before the meeting, and there was a lot in here, a lot of great information, but there will be a point in time at your budget work session. I'll have to talk with Jennifer and see when or when you prefer, Mr. Chairman, maybe when we start talking about debt policies and our financial policies. A lot of people, they see that 20+ million, not saying you guys, just in general, people at home. Oh, they're sitting on $26 million. There's $26 million there, or 24, whatever it was in there. But there are policies, we have reserve policies and joint stabilization reserve policies that will easily, basically those monies have to be accounted for. So it's not a, it's all there available at any time, because we have plenty of capital projects we would love to roll through. But we'll get into that more at the budget work session. And certainly if there's any questions beyond Jennifer or myself, we'll be happy to reach out to Mr. Foley and his team to get any answers or have any follow-ups that's needed.
Okay. What else? Okay, David, thank you. Appreciate it.
Thank you all. Thanks for having me.
And I'll
Okay.
take the box of copies before you leave. We'll get those.
Okay. Thank you all very much.
Okey-dokey, let's see. All right, so the next special appearance, we have Lieutenant Tiffany Rannenbarger from talking about community paramedicine. Welcome.
Thank you, Noah.
Chief Hillstrom is passing out some packets I made. The first two sheets are kind of just a once-over that sums up the community paramedicine program. So if you don't want to be inundated by the 30-page presentation, it's kind of the bread and butter of it. There's also 5 letters of support from community agencies. 2 of them are personal references. One of them was actually the stepdaughter of a patient that we took care of in our program.
Okay.
So the Madison Community Paramedicine Program started February of 2024. And essentially what we're doing is we're taking a specially trained paramedic off of the ambulance to go out and visit patients that have non-emergent needs. In doing so, this allows us to cut back on calls that are not acute emergencies that require an immediate transport to the hospital, and instead address any underlying needs that they may be falling through the cracks, and that's why we keep going to their house. This could be anything from frequent falls. I don't know if any of you listened to the recent 911 calls. Just in the last 2 days, we've had at least 4 patients that have called us just for lift assist. So that's a perfect example to us that illustrates, okay, you know, you're falling for some reason. So what resource can we get you, make phone calls for, partner with a community organization so that you don't have to call us for a lift assist and you can be at your home safer. One of the biggest initiatives that we're currently focused on is fall prevention. With that, we provide free fall alert devices that hook into your landline to any of our individuals that will qualify. A lot of our patients are on fixed incomes. One of the struggles that we've had with that is that it has to hook into a home landline. Not a lot of people still have a home landline. Cell phones are the way that a lot of people are transitioning to. We have successfully piloted another device that's 25% of the cost, probably less than that, one-time fee. Works just like a watch where they can literally push a button and contact 911 that way. It doesn't have to go right into your landline for those patients that don't have cell phones. Initially, when our program started, our goal was to focus on those patients, as mentioned, that we would go out to frequently. There were, surprising to a lot of the members initially when I made the presentation, there were over 25 patients, and we had been to their house over 18 times just in 1 year. So to us, that tells us taking you to the ER is not going to fix the problem. There's something we're missing. Our healthcare system does a great job where it can, but when patients fall through the cracks, my obligation, if we see that need, is that we should be able to fulfill it. So with our program, there's 4 criteria specifically that we look at to accept them into the program. Is this patient in need and willing to participate? There's a lot of patients, oh, I shouldn't say a lot, a small handful of patients that we wanted to help, but they didn't want to have people in their home. They were very uncomfortable for it. If that's the case, that address will get tabled, so to speak, because we still recognize there's a need, but at this time, that patient doesn't want to participate. If their circumstances change in the future, that's something that we'll look at because we know that that need is eventually going to still require some assistance from us. If they have limited resources or an immediate need that if we don't fulfill this, there's a higher chance of injury or death, then that's something we look at. Some patients have the financial means, but they just don't know where to go. So in that predicament, we would provide resource utilization, make some phone calls, and a lot of times it's as simple as 1 or 2 conversations to be able to get these patients to have a better health integrity and stay in the safety of their home. And is the patient at risk or injury or death increased if we don't offer services, as mentioned before? The last thing we want to do is say, hey, sorry, we don't have time to help you, and then something catastrophic happen. That's not what our career is about, nor is that the field that we focus on. The next slide kind of just goes through what happens if we have a referral. Initially, our referrals started by coworkers. As word has gotten out, we've actually gotten referrals from DSS, so the patients haven't even entered the 911 system with that example. But DSS knows what resources we have, and if we have the time to fulfill it, but it's not something they can do immediately, a lot of times that allows us to completely prevent that patient from getting to a point of calling 911. One example of that is we had a patient that needed a wheelchair. DSS was working for long-term care benefits for this individual. When we went out there, the wheelchair had like chunks missing of the rubber on the tire. We partner with American Legion here in Madison, and they have a Hot Wheels program that entails a storage shed behind Pig and Steak, and they have a lot of used medical equipment. So we were able to get her a wheelchair that day, and that led to 2 months of not calling 911 for falling because she had better equipment. So if we have to go out to a patient's house, that just requires me to go out there and ask a whole bunch of questions, essentially. It can be everything from what are your financial means to what medical problems do you have? Are you able to pay for your medications? Kind of just getting the whole picture as opposed to that 10-second glimpse that we'll have on a 911 call. This graph illustrates the number of patient referrals and those that were accepted. Some of the patients that may not be accepted into our program is if during their healthcare venture, if they were referred to us, but then after they were discharged from the hospital, they were discharged right to a skilled nursing facility. That no longer warrants our attention. We do, again, table it because if they get discharged, from that nursing facility, we want to make sure that we can still meet their needs as a community. As mentioned before, some patients that don't want our help, or if the patients move out of the area or pass away. When the patient completes or is terminated from the program, completion can be if they no longer need our assistance. We've provided everything we can to try to give them a leg up, essentially, and they go 90 days without calling 911 for services. If they're discharged, those are patients, again, that are placed in long-term care facilities. If they pass away or they didn't meet any of the qualifications, or the immediate need has been fulfilled. An example of that, we also give out smoke alarms. We've partnered with the American Red Cross in Charlottesville. So if we have a patient that just needs a fall alert device and needs 3 smoke alarms, once we meet that need, we'll still watch them and make sure there's nothing else we're missing, but that wouldn't require any additional visits to the home. So then we can continue our progress with other patients involved. Some of the KPIs that were noted with the program, we had a total of 90 referrals from February of 2024 until December of 2025. 90 patients had initial follow-ups completed, which means I went out to the home or had a phone call with them. After the phone call, if they're allowing us to come into their home, that's when I would make the in-person visit. 58 of those patients were accepted into the program, which meant that they required that additional visit at home and then some more work on the back end. 26 of those patients we ended up following. 43 of them completed or were released from the program. Currently, we still have a caseload of 15 patients that are enrolled. The next 3 slides just talk about the 3 years, because we're going by fiscal years, which I'm still adjusting to. The first fiscal year of 2024, we called our program build-up phase. We did have one of the biggest successes with that is we had a single case of a patient that had no 911 calls for 60 days after they graduated the program. 2025 was our expansion phase. Our referrals more than doubled to 50. We were able to fulfill 24 immediate needs. 4 of the patients got placed into long-term care facilities, and we had 1 patient, again, achieving 2 months without 911 utilization. Our fiscal year of 2026, we called our stabilization phase. We had 17 referrals. 4 immediate needs were fulfilled, 2 long-term care placements. We've had to do a waiting list because our resources are thin. I work as a lieutenant and I also run this program. So I have amazing coworkers that step up to help when they can. But along with our 15 patients we're actively working on, those 3 patients on the waiting list have had to kind of be sidelined just because we risk losing the efficiency of the program if we spread ourselves too thin. The overall program referral and acceptance evaluation, as stated, we had 35 immediate needs were fulfilled, 7 patients total were placed in long-term care, 10 patients passed away, and 22 cases altogether didn't meet criteria. Just to illustrate exactly the success of some of the patients we've had, I chose 7 patients that were in the program at varying times. Our average time in our community paramedicine program from patients usually ranges from 3 to 4 months. 1 patient I was going out and visiting every 4 weeks just to make sure his medications were okay, he didn't need refills, take his vital signs, he was doing physical therapy, exercises at home to be able to maintain his strength to live alone. But those 7 patients that we followed, I pulled the metrics for. And prior to our program, there was a total of 38 911 calls between all of them. The orange represents after the program, after they completed the program, and we only had 2 911 calls. So that's a 94.7% decrease in 911 utilization. And that's just with those 7 patients. As stated, we had over 90 referrals, so this is something that will make an astronomical difference. The next chart just kind of shows when each patient was in the program, how many calls and how many units were required to go for each call. We had 1 individual that required 2 ambulances to go just for safety lifting mechanisms with our staff. In addition to that, we had to carry him up very steep steps. We actually partnered with Cardinal Home that provided wood. We were able to build him a ramp. The patient was an amputee and wheelchair bound, so he required dialysis 3 times a week. Medicaid, I giggled when they mentioned the inconsistency of Medicaid transportation in one of the previous presentations because that is very reliable. That being said, the individuals that came to pick him up were not equipped to be able to carry him out of his house. So they would call us to do it, 1, for patient safety, and 2, because if that patient misses dialysis, they can often go maybe 3 or 4 days before they end up in the hospital in ICU. It's very critical for them to be able to maintain their health. So we had 2 ambulances going at least 3 times a week, twice a day for that specific patient. Once that ramp was built, there was a 100% decrease in 911 calls to his house for 2 months. The next slide is just the illustration of 94.7% that we've had a decrease as a success of this program. We averaged about 4.7 months per patient. 36 was the average calls that we estimated to be avoided, and 24 transports were avoided. The biggest key here is the readiness hours. So cost savings is going to be one of the biggest things we look at with any program, and especially this program. We want to know how much is it going to cost, what's it going to cost to the citizens, and what's the benefit. So 86.5 hours with those patients just in reducing their 911 calls is how many hours we were able to put an ambulance back on the street. Nobody wants to put a dollar sign to someone calling 911 and not having an ambulance available, but putting an ambulance back on the street for an additional 86 hours is extremely significant. I got some figures from my chief, and we've been cataloging the NUA times over the last couple months. The last 7 months, our total NUA times were about 70 minutes. So just to put it in perspective, from July covering through January, those 7 patients and the time we saved would have negated the entire NUA for the last 7 months. it's hard to quantify cost savings when you talk about 911 calls that were avoided, but we did our best here. If we're estimating a $600 fee per transport and the 24 transports were avoided, that's where we got the $14,496 from. Additionally, the $400 for 911 call, this would be your lift assist. And the reason we put $400 is we're accounting for vehicle expenses and hours in service and on the street. Bless you. And we got $14,400 for that. And then if we estimated a $30 an hour per crew hour, that was about $2,600 for a total of $31,491. And again, this is just with those specific 7 patients that we followed. The next page, I wanted to scale it up just to show you our potential. If we increase that 7 just to 25, and again, our program had 90 referrals, so this is not that hard of an ask. Our cost savings with the same metrics would be about $112,481. The crew hour readiness gains represents 33% improvement in our EMS availability, just again with these specific 7 patients. We had up to 100% reduction in 911 dependents for 5 out of the 7 patients after they completed the program. As mentioned before, the fall prevention is one of our biggest initiatives. Our population in Madison, according to 2024 data, 45% of our population is age 50 and older. It only takes one fall for a patient to break a hip, have a surgery, that surgery to get infected. There's a person in our program that is actually an amputee because when she fell and broke her femur, she spent 6 months in the hospital and got an E. coli infection. And she didn't leave the hospital. She was only in the hospital for those 6 months. Because the infection got so bad, they actually had to remove part of her leg. So now she's wheelchair bound for the rest of her life because of a fall. So our biggest goal is to prevent that catastrophe. If we can prevent the fall with the fall alert device or by looking at the throw rugs, handles, stair railings, increasing the light in hallways, a lot of that is extremely paramount. We had about 2 weeks ago when we were having the freezing temperatures still overnight, we had an individual who was 73 years old. She went outside to take her trash out and she fell. As a result, she was outside overnight for 10 hours before the neighbor came home and found her on the ground. And that is the kind of stuff that we should not be seeing. These people have worked their whole life, and they're the kindest souls. And to be on the ground, I can't even imagine what that was like at my age, not someone in their 70s. The patient was severely hypothermic. We took her to the local hospital. She ended up getting transferred to a critical hospital. But these are the patients that we see that need our help. And even after the program being in success for 2.5 years, we still have needs that are falling through the cracks. Which leads me to the reason for this presentation. If we can have a full-time devotion to this, that is the situation that we're aiming to avoid. Fall-related data for this county is significant from 21 to 25, and this is just based on our 911 calls. These aren't patients that fall at home and a neighbor takes them to the hospital or a family member takes them to the hospital. Just from 21 to 25, they rose from 191 to 334. So that's a 74, almost 75% increase in calls. The last year saw a 40.9% from 2024 to 2025, and that doesn't include the most recent ice storm. I can almost guarantee our numbers next year are going to be astronomical. They now make up a much larger share of our workload. About 15% of our 911 calls are specifically for patients with fall. And because of the patients calling for fall, that increase is 3.5 times faster than the overall demand of 911 calls in general. So not only is it a bigger issue, but it's something that people are getting to the point where they have to call 911 for. If it's just a lift assist, that's great. To me, that means you don't have an injury, but we still have some work to do. But but we can tackle that before you get to a catastrophic phase. I wanted to speak on unintentional injury deaths. That's something that, if any of you are familiar with the community health needs assessment, that's an assessment that hospitals are required to do every 3 years, or the Department of Health, basically cataloging what needs, whether it's health needs, social drivers, are for each community. Madison County has a rate of 72.8 unintentional injury deaths per 100,000. The statewide average is only 56.8. So we are actually 28% higher. And that's only from data from 2024 and before that. So I would argue that number is probably even higher, especially considering the injuries that we've seen with some of our patients. When they fall repeatedly, obviously your injury chances increase drastically. If you're 65 and older, the leading cause of injury death is fall. This is just the operating budget that we've been using. Essentially, we haven't had to pay for any equipment. We have everything we need. With our last response vehicle being updated, I've been able to use the older response vehicle, R3, that we have. It's still in service. Our biggest annual expense currently is the EHR software called Julata. And one of the benefits of this software that we haven't had a chance to tap into is we're able to allow our other community organizations that we work with to be able to see patient information based on what the permissions are allowed. So if I go and visit a patient, but DSS is also working with them, I can allow them permission to see that patient, so that might save them a visit to their house and mean that they can get services to them quicker because they'll have all the information from my assessment and the questions we asked. I am a little partial, but I would argue the CP program is extremely vital in Madison County. A lot of the patients, in addition to being aging and having a rising fall burden, are geographically siloed. So we have patients that sometimes the only interaction they'll see is if they call 911, and that can be for a couple weeks, which is great. I mean, the Blue Ridge Mountains are beautiful. Etlin is beautiful. Graves Mill area is beautiful. But sometimes that also means these patients are neglecting their health needs. They're not going to see primary care doctors. They're not getting their medications refilled if they even drive. So this is all stuff that our program allows us to be able to participate in and partner with organizations to make happen. We try to identify the risks before the fall occurs, reduce the repeated 911 usage, and protect high-risk older adults in rural communities. We've had a high impact and it's been cost effective, but our capacity is currently constrained. We have 4 patients on the waiting list. The best thing about this, though, is it's a stabilizing force for our EMS operations. EMS calls are going to continue to increase, but if we can manage those patients that don't have acute emergent needs by fulfilling the underlying cause, then we're allowing ambulances to be back on the road for patients having active heart attacks, strokes, or traumatic injuries. The other value associated with this is provider burnout and also the physical risk with our providers. When we go out to do lift assist, lifting mechanics is one of the biggest things that we try to promote. Sometimes at 2 a.m. though, you're not completely aware of your surroundings, so it's easy to slip or misstep. But if we prevent that fall from happening, that means that we don't have that lift assist call at 2 a.m. and essentially we take away the risk of our providers from lifting patients incorrectly. And that is everything I have for you. What questions can I answer?
Questions from the board?
Gotta have someone else can go first.
Go ahead. Good?
I was just going to point out, Mr. Chairman, you had asked in advance for questions to anticipate tonight. They have provided that, so I believe
Yeah,
each of
they-
you have a handout, front and
handed
back.
us-
It's 2 pages, front and back.
Yeah, right. Yeah, I think these are the answers some, yeah, okay.
One of the things I do want to speak on real quick is the sustainability. Funding is obviously our biggest concern. With the big beautiful bill that came out, they included the Rural Health Transformation Project. Virginia was awarded $190 million for that. One of the initiatives they've earmarked is community paramedicine, exactly what our program does. And they've specified $84.7 million just for those causes. It's going to be through the Department of Medical, the DMAS, I forget what that acronym stands for, Department of Medical Assistance Services, I think. And so our application will go through them to hopefully get funding for our program. To date, I haven't received any word of what that application looks like, but we are watching any of the information coming out. But that's a huge win for this line of work in general.
So that grant possibility is coming up
Absolutely.
soon.
Yeah. The last I had heard was April. But when I was researching it after our conversation with you on Monday, I haven't found any more information to date about it. Some of the information states that the Virginia Department of Health and Office of EMS is going to be disclosing the funding, but the article that I was reading where I got the majority of the information to date was through the Department of Medical Assistance Systems.
Okay, go ahead, Mr. Jewett.
May I call you Tiffany?
Yes, absolutely.
All right. First of all, Tiffany, I really give a shout out to you and Noah. I mean, trying to quantify these cost savings, it's an arduous task, and I think you've done a great job. I think the cost benefit of this is evident. Now, the next question I want to get is kind of going to get into more of a political aspect on the funding. How many other localities are doing this program? Any of our neighbors doing this or thinking of doing it? Or?
Rappahannock is in the process of partnering with Rap at Home to start one. I'm in contact with the individual doing that. I've been able to answer a lot of her questions to help her. UVA in Charlottesville has one. It was started hospital-based in a way to reduce the readmissions of patients with substance use. So they had a little bit different initiative than we did. They did it as a cost savings, which meant they didn't have to have that seed funding up front. In addition to that, there's one in Harrisonburg, but surprisingly, Spotsylvania doesn't have one. Franklin County, Virginia actually just got awarded $198,000 of opioid abatement authority funding to start a community paramedicine program last month, I believe. But in total, there's about 14 statewide.
Okay, where I'm going with this is this has been an ongoing discussion with the board recently, and this is a result of our dealings with the General Assembly on other issues. But one of the things our state representatives have impressed upon us is that we need to start looking at legislation earlier by summer. So what we're going to be doing is, hopefully, we will be putting together some legislative proposals for the General Assembly for next year, and part of that effort could be to ask for, whether to ask for more money or ask for clarification or something to help improve this program. Because I assume there's no group that actually lobbies any legislator at any level to do this.
No, sir. The Joint Commission's healthcare report, which was actually received through some of the cohort groups within the General Assembly, it was piloted by Delegate Rodney Willett. Actually spoke a little bit about community paramedicine, but it was enveloped under mobile integrated health and along with home-based health care. So they're aware of it, it's on the radar, but like you said, there's not any current legislative that's pushing it forward.
Okay, now the grant that's coming from the federal government, that's being administered by a state agency, correct? That is, okay.
It is. They've separated it into 4 different programs. I believe community paramedicine falls under the Connected Care Close to Home initiative that they're doing for rural agencies, and that's why they were focusing so much on community paramedicine efforts.
Okay. At the board's pleasure, I'd like to pursue the possible legislation or lobbying efforts with the General Assembly that we would be formulating this summer to work with these folks to perhaps come up with something along those lines. I mean, we know that sometimes it's a futile effort, but if you don't go and holler or ask, nothing definitely is going to happen. Is that okay with you guys?
Certainly.
Mike?
Yes.
Yeah, I'd be glad to do that, because you really, those people are hardheads down there, and unless you go and you complain and you whine, they don't listen to you anyway, but if you don't speak up, nothing will happen. And I'd be glad to do that and to help, quote-unquote, lobby the legislator to make this happen better for us. I mean, it's just, I think it is an important program, and as you said, we're getting older and we're getting older. And I know dealing with grandparents and parents and the challenges with those folks have in trying to get them to stay healthy, it's a challenge. So this is, I think, a good program. And, the county, can't speak for the board, but I think this is something that we would probably fund. Can't make any promises. But even if we proceed with it, we need to go after the state and federal money to help us out. They can throw it away on all kinds of other things. They can help keep people in their homes. That would dramatically reduce Medicaid nursing home costs. I think that prevention is the way to go with just about everything, but it's hard for people to see the long-term net benefit of prevention versus immediate expense. Thank you. Thank you, Mr. Chairman.
Mr. Chairman, I just want to.
Yes.
Good. I've said this before, but what you're doing and what EMS does, and when people complain about the taxes in the county, and they say, well, what about our EMS? What about our fire department? And they're like, oh my God, yeah, they came out and helped my mother, they helped me, or they did something like that. So the county, then they're like, our taxes aren't so bad. That's what this is paying for. But to show the savings that you've shown and all the work you've done putting these numbers together is pretty impressive, and I think it's valued, and just want to say thank you. I get the calls, right? I see how many falls in this last month has been incredible. I mean, I fell twice myself, and I'm not 65 yet, but I'm getting close. So what those numbers are going to show next year is just going to be astronomical, like you said. So thank you for what you do.
Power of suggestion. I see all those falls, the next thing I'm getting dizzy when I fall myself.
And Mr. Chairman, I'd like to add to Supervisor Druitt's, because we've looked at this before, and I think Orange, I don't know if they still have their program. They had
do.
it, but.
Yes,
Okay.
I forgot to mention Orange.
No,
Orange
that's
does have
fine.
many
I was just
programs.
doing a quick, I didn't know if I know at one time they were hiring, I wasn't sure, programming if they went through. We've looked at this a little bit before when we started small, and I mean, hats off to Tiffany. You're looking at the program when you're looking her direction. You can sense her passion here tonight. So right person for the program. It is a sustainability question. I don't know why certain states or, feds or states provide funding for. So for example, and I think this is also termed in some capacity as mobile integrated health. They're kind of interchangeable. West Virginia is able to have some funding. Right now, the way funding works, and revenue recovery is probably a terrible name. If an ambulatory, and correct me anytime I'm wrong here, either chief or deputy chief or Tiffany, if an ambulance shows up, there's billing for that. Now, if you're a county resident, you don't pay. It's an all insurance thing. Being this is a non-ambulatory service, it's a great service because you're trying to look at preventative versus reactive. You're not allowed to bill for that. West Virginia, I believe, is a state where they allow for that, and that makes it more affordable. So we certainly will have a congressional representation here handing out a check for the Sheriff's Department's grant. We certainly can talk to them on the federal level as well as the state, because, I mean, if West Virginia is doing it, I don't know why Virginia citizens should be any different. So that's my personal opinion, knowing the program, and I know some of you have been around since the start. We said start small, and we know the falls are part of that. I think also interacting with the Munch group, I forget the acronym, but it's a lot of those people that you have endorsement letters from that go to that meeting. They're service providers, and they share stories. Great program. The decisions you're going to have to make, that's one of the reasons why I wanted you to be aware of this program and where it's at. We will have some additional discussions come budget time. But my opinion, it's a great program if we could get that sustainability level, some additional help. You can see, trying to quantify it, I can only imagine the task of that. But to your point, Mr. Buchanan, if there's one thing, and I hear it all the time too, what do I get for taxes? Hopefully services you don't need at this time. But it is one of those areas that, outside of Orange, we're really ahead of some of the larger communities such as Culpeper and others. So hopefully we can get some dollars. I would also encourage hospitals, they're probably not, to maybe kick in some money because these are patients that are not coming to them. But anything we can do in the lobbying front, Mr. Jewett,
Yeah,
is
we're gonna have
best.
to do that. I'm wishful thinking, but I think about that $84 million. And wouldn't it be nice if we could get some money out of that to pay for equipment and vehicles too? I know that's wishful thinking, but.
Right. I'm with you.
Well, I know, so I was on the board 2 years ago when you first floated this to us. I guess it was 2 years. And at the time, we said, show us how this would work. And I think you have done that. So hopefully, we can make this thing work. Now, in talking to you the other day, isn't there, what could transpire that could create a reimbursement situation? Didn't you say that there's?
Yes, so treatment in place is what they call it. As the county administrator mentioned, the only time we get reimbursed for ambulance usage is if we put miles on the wheels. So if we're not transporting you to a hospital, if we come out and start an IV and give you liquid sugar to raise your blood sugar, we don't get reimbursement for that. This grant funding actually allows for that treatment in place. In addition to, there's actually some bills that, so annually we go to EMS Day on the Hill in Capitol Hill and we speak with different delegates there. And community paramedicine and treatment in place is one of the hot topics. It has been for the last 3 years. We plan to go this year. But this specific grant actually allows for the availability and the technology backing to have that treatment in place. So if we go out and offer the services we're currently providing, we would then be able to bill their insurance. So it wouldn't necessarily be a cost increase to them, but that would allow tax money essentially to not have to fulfill the need of sustainability means.
Okay. Mike, you had something?
No, I've got 2 pages of notes from our meeting earlier, so I've had most of my questions answered
Okay.
already. Thank you.
Yes, sir.
One last quick thing. I've volunteered for years for Meals on Wheels, and the things you do with Meals on Wheels is you keep people in their homes, right, which keeps them healthier longer or living longer. And it sounds like that's what you're doing too. You build a ramp so that person doesn't have to go into a facility, which typically people go downhill quicker when they're in a facility. Second thing, you're checking in on these people. They may not have family members that live nearby, or they have no family or friends that don't check on them. So you guys are also doing that. So I think that's 2 areas that you're adding value to the county.
Yes, sir. Thank you.
So, yeah, thank you for these questions and the answers to those questions. I think it'd be good to, I'm the kind of person I gotta read it a couple times, so I'll take this with me. Anything else? Okay,
Thank you all.
Thank
thank you. Noah, Gavin, thanks.
Thank you, gentlemen. Gavin. Yeah, my mother had throw rugs in her house, and she would put throw rug over throw rug, and she'd fall over them. You pick them up, she'd go find them, put them back.
You bet, don't change your rule.
What do you do when you find those cats in the house and that you're tripping over? Okay. Oh. All right. We have no public hearing tonight. We got no old business, so we'll go straight to new business, EMS generator. Mr. Weekly.
Yes, sir. There are planned capital improvements, then there are just emergencies that you're like, okay, what do we do with? We have various generators throughout the county. They're on a testing program cycle and so forth. But outside of that program cycle, we'll go by if we know we got a winter storm or something imminent, fuel level, where you at, functionality. So the EMS generator was an existing asset when we went through the building renovation. We did put a new automatic transfer switch, an ATS, on the building because there was an old mechanical style. That generator, when the rescue squad had it, it went through annual testing and maintenance and so forth. when we took over the property, which included that asset, we had it load tested, we had it looked at and all that. So it was deemed operable, and we've transferred it, we did all that. Even the building official has to do that before they sign off. So right before this, I don't know, what do you want to call it? I call it concrete. It seemed like it was falling from the skies you had to remove. But it failed. It would not cut on and so forth. So we did bring in and I thank EMS for their help as well in monitoring the fuel and everything during that runtime. But we did bring in a temporary rental during that time. I think it came in the day before, right before the storm hit. We had a company named Power Connection. We have some familiarity with them because they handle generators at our emergency communication tower sites. We had them come out and look at it, tell us what is wrong with it and what's the cost to repair. In your packet is a repair cost from that vendor. I don't know if they gave you a total there. It's around, $33,810.88. So you can see the breakdown. They give you the tech rate. The alternator assembly was the biggest component, and that's how you generate power is with that assembly. A circuit breaker, a safeguard breaker, and then their freight and travel time. We do have companies giving us cost for replacements at this time. My thought is I like to see new. And then evaluate that. It's all to your decision, but kind of my philosophy is if you're hitting 50% or higher repair costs of what replacement is, it makes sense just to go ahead and replace that asset. Also coupled with the fact they're a 24/7 operation. One of our newer requirements was they have a pharmacy now. We don't get medicine from the hospital. That has to be maintained not only securely, but at temperatures. That is regulated by the DEA, which Mr. Hillstrom signs off on. It's his license, I should say, on the line. I don't want to say other things. So the importance is really there. If it was a generator here at this building, I'd say, let's try it. I mean, we generally pinch pennies everywhere. But I think we'll wait and see what those replacement cost is and compare and bring that back to you. Brian did a good board report, but what we discovered in his board report, it talked about maybe an estimate of a replacement being around $40,000. He had gotten a quote from Power Connection. I don't know why they gave the goods and not the services, so we need to know turnkey price, because what's good is a generator sitting on a skid if it's not installed. So we believe it'll land somewhere between 40 and 60, but we need to get additional costs. I had some conversation with Supervisor Snyder before the meeting. He's got some good connections as well with the vendors, so hopefully we'll land somewhere with a good number. It's an 88 kW generator now. I think we should look at maybe up to 100 kW. There may be some growth in the. It's not called a hot standby EOC center now, but the modular building they do training in. But we've talked before, do we want to do an EOC or something with that location? So giving yourself that extra room would make sense. I don't think it's going to make too much difference of price going from an 88 kW to 100. But again, we're waiting on the vendors to provide that cost so we can bring that back to you. I would say we want to do this as soon as possible, but again, wait for the information. So hopefully before your meeting on the 10th, we should have all that information and bring it back to you for a recommendation and ultimately a decision by the board. So I'm happy to take any questions.
We're exposed right now. We have no.
We would bring in, even though we sent the rental back, those companies, there's a variety of them. Power, whatever their name is one of them. Carter, Fidelity I've worked with. You would bring in one.
They can get it here within hours.
Yeah, that's generally what they.
So like the pharmacy that I saw the other day, if you lose electricity, how long will that box hold? 12 to what? Okay, so that's plenty of time to get another.
Yeah.
True.
Time is definitely of the essence, but we need to have those replacement pricing.
Okay.
Very nice.
So that existing generator, I understand, is probably about 30 years old right now, right?
Yeah, easily.
Yeah, I mean, I remember going down there when we bought the building, and if I recall, that is a PowerTech Series John Deere engine, which would be put it about 30 years ago. And they're good engines, but they don't run forever. If you have to overhaul that engine, you're not gonna do it for less than 12 grand. There's some local dealers around here, probably be 20 grand. I won't mention any. But anyway, Mike, I have to agree with Mike. I'd really like to see a Caterpillar engine there. It'll outlive all of us. But there again, I think you're gonna do it, just replace the whole doggone thing.
Yeah, I mean, I agree with that, but we want to make
Yeah.
sure we get all our pricing.
Right.
We'll bring it to you all for decision. You know, as far as funding, I imagine this is going to come back with a contingency fund request, which we have balance there. We try not to use it, but this definitely would meet that criteria, certainly.
Okay. Anything further from the board on this?
Would we also be looking at probably getting in on a PM schedule with another vendor? How's that?
My recommendation is going to be, and I think I had a brief conversation before the start of the meeting, Supervisor Snyder, is, and I think it's been based on relationships and what operation has what generator. You know, when I started talking generators, like this last week, whatever, I heard, okay, we got a company that does the generator at the firehouse, which we take care of the maintenance on that. That was kind of an agreement years ago when it was constructed. We have a different vendor for the generator there at 911 and Sheriff's Office. And then we have, the one that probably has the most inventory is this Power Connections company, because they do all of our tower sites. But getting down to one provider would be great. I mean, really, whether it's a Cummins or CAT or whatever, you know, a mechanic should be able to perform functions, PMs on that. So I like to get that consolidated. That just makes sense anyway. You generally get a better value if you're packaging everything together. I'll talk to Mr. Gordon about Power Connection, because I know we've had this long-standing history, and I know he's talked good about them. I mean, they're generally 2 hours and less. It doesn't matter if he calls them 2 in the morning. But we certainly need to try to get that under one umbrella. So that's been my experience from my past utility world, is get one provider.
Yeah, and the school's got a provider for that new generator out there too, I guess. Okay, anything further? All right. Okay, next item on the
Explain this
agenda,
to
the
the Commissioner
Commissioner of Accounts lease agreement.
I
Mr.
have
Wright?
not heard back from him yet.
So Attorney Jeffrey C. Early here in Madison is the Commissioner of Accounts for the Circuit Court, which means that he is tasked with certain responsibilities from the Circuit Court to include, one of the biggest ones is making sure, like when estates are opened and closed, that they're accounted for properly. It just keeps it sort of off the Circuit Court judge's plate. And as part of that, he sometimes meets people in his office. My understanding is that this was a kind of a pre-existing handshake or oral agreement that the space in his office would be used occasionally, and I think it was, what, $60 a month or something like that to use it. And so I think this request came from Ms. Warren for audit purposes, for us to be able to, for her to show that we have this lease, and that's why this expenditure is made. And so, I'm not sure we've,
We can't find a pre-existing.
right. I have not heard back from Mr. Early about whether or not this is an agreeable form or not, but I tried to keep it as simple as possible. But that's the purpose of this, and it's basically terminated by either side with, what, 3 weeks' notice or something. Just, it's not a long-term contract, hopefully fairly straightforward. But happy to answer any questions on it or its language.
I happened to have a quick little conversation with Mr. Early about that, about how expensive that seemed to be at $60 a month. And he said, well, you know, I've been doing this for 30 years with y'all, and he said that he hasn't gone up in 15 years. So he's apparently been doing this for 15 years at $60 a month, which includes a file cabinet.
Well, I never want to extend any appreciation to Mr. Early, but I will in this circumstance.
Okay, so it's effective February 1st, 2026, and it continues month to month, so there's no end date in there, but there's a possible termination if on either party. Okay, that's, yeah. Hmm.
21 days.
Yeah.
And did this come up through the audit? Is that how, what happened?
I don't know the full backstory of it. I know Ms. Warren was saying that she needed some paper to be able to justify it.
Yeah, because anytime, because we, you know, the monthly invoices come in, so this be one of them, and quite often Jennifer will go back and check, so I believe this is one she caught, but it's definitely good to have these on file, even though if it's $60 a month or not, because, you know, I like to work off the old days handshake agreements, but now, you know, auditors like to see formal agreements, so.
All right, then, what's the board's pleasure? Move to approve this agreement?
Yeah, Mr. Chairman, I move that we accept this agreement, and if it works out for the other party, I agree we should do it.
All right, that's a motion?
Second.
We have a motion and a second to accept the Commissioner of Accounts lease agreement. Any further discussion?
I'll just point out of course, you know, Mr. Early's got to sign it, so we'd be approving
Oh,
it
yeah.
subject to his also acceptance. If not, we'll bring it back in front of you.
Okay, you're gonna amend it to subject to Mr. Early's
I-
approval.
I thought I did that.
Oh, you did?
He did.
Oh, you did? Oh,
Yeah, I think we're good.
okay, very well. All in favor, say aye.
Aye.
Opposed, nay. Okay, motion carries. All right, what we got here? We got no discussion, information and correspondence, public hearings, Mr. Weekly.
Yes, sir. There's two in your packet, but I want to cover one that's not in your packet because I've been seeing it going around online. There is a public hearing being held here March 2nd. That is DEQ's public hearing. And that was based on board action when you had your public hearing concerning the permit renewal for Mountain View Nursing Home. And then DEQ granted that request. They worked with our office. They asked, could they use it as a venue? We said, sure. I mean, citizens know where this building is, come here. So it is their public hearing. And I do plan on, unless something would pop up, I do plan on attending that, just sitting in the back, not just to open and close the doors for them, but just to really hear the community feedback on it. I don't believe
7 o'clock?
DEQ, what time we have at, Kim?
It says 4.
I think 6:30 is what the ad or something said in there. So again, I don't think DEQ will probably make a decision at night, because it's the public hearing. You want to take in the public input. So I just want to be there, that way any information I can relay back to the board, kind of the temperature of the room, if you will.
I think it'd probably be pretty wise for, I think I will not be able to be there that night, but some of us probably.
If, you know, if two, I would say keep it at 2 or less, because we did
Yeah,
not advertise
that's right.
for a special meeting or public meeting. I mean, if that's what you like to do, we'll put a post up, you know, tomorrow about a special meeting, but if not, if we can limit it to that want to
So it's,
participate.
this coming Monday at 7. So
I think they had it at 6:30 is what the advertisement had.
We'll have to advertise it. If I
Oh, I'm
remember
sorry.
correctly, it was like a certain time, it did some, like a specific question and answer, and then it did something else at another time.
Yeah,
I'm gonna try to
because
pull it up.
we have it on the calendar, I think, for like 6:30 to 8:30.
But that might be separate.
So,
I've got it in my calendar
So
at
you-
7 o'clock, so I've already planned on
You
being
plan
here.
on being here, okay, well, that's at least one of us.
yeah, that way we're kind of, you know, seeing what is being said from both sides, you know, from the regulatory's perspective, from the citizens' perspective. Now, on to what is actually in your packet.
Can I ask a quick
Yes,
question?
sir.
So can someone zoom in, a board member, or is that considered
If it's beyond 2 and one wants to Zoom online,
just monitoring?
as long as they're,
Are you just watching it and not participating?
Yeah.
I think you're fine.
Judd, if you want to come, that's fine, I'll hang out.
That's all right, I'll zoom in just to. You have two here, right? That's right. And you're coming?
I was planning on it.
Anybody else?
You, Nancy, are you coming?
I had it on my calendar, but I don't.
Oh,
Yeah,
then
at
come on.
7 though. I have it down for 7.
Can we verify if that's 6:30 or 7 at some point, I guess?
We can do that and send out, we'll reach out to DEQ tomorrow. Hopefully they'll respond back to us tomorrow and we'll send out an email.
think there is any online version of that.
No, we would have to talk to DEQ about if they're fine with streaming or anything, because unless they ask, you know, occasionally we'll get that, like RSA uses your auditorium. Occasionally we'll get that. Most of the time, they just show up. So we can ask them about that if they're fine with streaming. I'm happy to dial someone in. You'd have to listen from my phone, but.
Yeah, I
they
remember
generally
looking at
don't.
this when it first got announced, and they don't, at least DEQ doesn't plan on doing any streaming of it. I can tell you that.
Agree with that. So Mike and I'll show up.
Okay,
Okay.
so
All right,
perfect.
what else you got?
So the two scheduled public hearings that are county public hearings that you'll hold, March the 10th, you have your public hearing for, that's the e-summons. Today, I sent it late, so you've got time to read it between now and then. I've seen some traffic too about this online. But there was a citizen that reached out about that summons. They oppose it, so naturally, anytime someone sends a position for or against, we'll have it in the packet for that meeting. But what I did give you in that email, as well as I did to the citizen, Captain McKnight gave a presentation during FY '25 on the various grants that the sheriff's office applies for. And in that presentation, it shows when we acquired, or how we acquired, once they started that program, the equipment and the software, we used the Brine grant, which is, that individual is referencing. And, you know, a lot of those DCJS grants or any of those grants, they'll cover equipment or maybe software. They're not really much on subscriptions. So we have an annual expense of a subscription for $21,000. The e-ticket system is a program administered by the sheriff's office. It is allowed per the code. I know Greene County is doing that. It's up to you all, you know, take the public input on it. It's a $5 fee. I know some view it as it's an unnecessary fee, or why doesn't county pick it up? Well, essentially, you pay for that subscription in FY '26. You know, don't speed, you wouldn't get the $5 fee, but that's just my opinion. That's not the position of the board, so. But that, I did include that citizen input to you all today. So that's on March 10th at 4 PM, or whenever you get to it as your order of business on the agenda. And then at your March 24th meeting, you may recall you heard information on the CPACE program. That's an economic development program. If you want to participate in that, it requires you to adopt an ordinance. There's no liability on the county for that. We're not the ones servicing that loan, but we do have that as a public hearing for March 24th. So that's all I had for public hearings. I'm happy to take any questions from the board.
Can I jump in real quick? too?
Absolutely.
I just found that public notice, and I can email it to you all as well. But it says the public hearing is at 7, but it also states the information briefing's at 6:30. So I'm not exactly sure what all that entails, but that's where that 6:30 number came from. But 7 for the public hearing.
Yeah, I would say they present the information and then the public gets their shot at them.
Yes.
On both of these public hearings, I mean, I could have lost the bubble. Have I seen the draft ordinances for the e-summons and the CPACE?
Let me check. I know they're available, sir.
Yeah.
I'll see if they've been circulated. If not,
Have you-
I'll make a note here now.
And that e-summons as well. I mean, just went $21,000 for the subscription. That's 4,200
Tickets?
tickets.
Okay.
Or not
Get
just
busy,
tickets, but
Sheriff.
whatever summons
Right.
that might be.
Right.
I guess we give out 4,200 summons?
I can ask the sheriff to
Is
see
that a
what an annual summons-
$21,000 annual fee, or is that?
Yes, that's an annual subscription fee.
Yeah, this $5 wasn't calculated. That's a maximum that can be
Right.
Put on this, as I understand it.
Right, and staff, or
That is
my
so-
recommendation would be, if you're gonna adopt the ordinance, go the full amount that the state code allows. So you're trying to really offset some cost, that's associated with
Yeah.
that, so.
Yeah, if nobody speeds and needs to get a ticket, then we're safer, and there you go. Right? Okay, if you would send us those draft ordinances, you got them, Kim? Okay. All right. Anything further? All right.
I do have one other item under information, it just popped in my head, I can't remember if I mentioned it at the last meeting, so cut me off if I did. We had a pipe burst, yeah, I did mention last meeting. So I sent we had a pipe burst, a water pipe under our scale house trailer. And I believe I sent an email around, that water, service line was repaired and restored, so there's water there. We had the insurance, adjuster come out and look, so we hope to have that information soon. From what I've seen there, and I'm exploring right now, is, all right, what's the cost of a job site trailer these days? The existing trailer out there, I don't know if that's the, if it was bought new, my guess is probably used when the transfer station, we went from a closed landfill to a transfer station in 1999. So there was some water and stuff that, got to the bottom, but when we pulled off those metal panels on that back wall that faces the old transfer station cell, or the landfill cells, water has been getting in there for some time, I would imagine from the roof, because on the trailer, they have very thin gutter systems that run the edges. Think of an RV, for example, it's almost similar design. And if that is not tight along with your panels, which can move over time with screws, they kind of create some expansion. But that back wall has some rot in it. So when you get to the age of that, how much money you want to dump in it? I would love to relocate that to the other side and do the scales on it one time, but that's going to take more planning. So what we'll go back with was, is the configuration where the scales and the scale house are currently. I'd like to talk to you at some point when I'm able to work with, design and get some cost estimates to realign that to the other side. It makes more sense to weigh in and weigh out from that lane than the current configuration. But we'll hopefully have some numbers soon. It's been hard to get numbers or on a replacement job site trailers. I talked to a vendor today, and a lot of it is because those job site trailers, they either offer rentals or purchase. We would be looking at a purchase, but data centers, all these things, between school construction and data centers, there's where your job site trailers are at. So the only one this one company had today was an 8x20, but it didn't have a bathroom in it. So I told them to keep checking the inventory and get back. So we're hopefully have something for you soon. It's safe now is the condition, but long-term, you need to do something with it. It was in our condition assessment report, the Bureau Veritas report I sent. But naturally, we don't replace those things just based on that schedule. It's based on condition. But what I saw on that back wall, yeah, bottom plate, 2x4s, it's got rot in it. So. Yeah, I haven't seen that, but I didn't rip everything out to discover. What was interesting, because I was knocking on from the interior, and they went, boom, put a hole. So, all right, well, let me see what it is now that I've put a hole in the wall. And it looked like some type of laminate cover that, they put those strips over in a modular home or whatever. And there was a level of sheet rock, which that was deteriorated. Insulation with your 2x4 wall, and then your metal on the outside. But a lot of that is just rotten. When you start, it's one thing if you have a vertical 2x4, but when the bottom plates is deteriorated, that's your support, so. Sorry for bad news, but we'll bring that back to you when we have prices as well.
All right, thank you. Okay, we're back to public comment. Any more public comment? Okay, we'll close public comment then. Then nothing, we have no closed session, so entertain a motion to adjourn.
Move to adjourn, Mr. Chairman.
Second.
Have a motion and a second. Any further discussion? Did he? Oh, yeah. Did you have an announcement you might make?
I can. I sent you, I sent you all an email about that.
Yeah, okay.
But I'll publicly share. I debated whether to put it on Facebook. I have been very public about it, but we have a great board, both past and present, that has been very understanding and supportive, along with the great team I get to work with every day. But we'll try not to be emotional. Back in May, somewhere between May and July of last year, I was diagnosed with stage 3 colon cancer. After 30 rounds of radiation, 8 rounds of chemo, and a lot of whining my wife had to hear, my scans and all showed today that said I am cancer-free. So
All right.
thank you. Thank you, Mr. Chairman.
Okay. So, if there's no further discussion, all in favor say aye.
Aye.
Opposed, nay. Chair votes aye.
I thought you'd find this interesting.
What's that?
You know, my son James is teaching JU.